Alright guys, welcome back, and we are continuing on our Unit 2 lecture. So we just talked about the difference in medical asepsis and surgical asepsis. So a part of surgical asepsis is applying sterile gloves. So you're going to apply these anytime that you're going to be working inside a body cavity. So whether that be working on a wound or assisting in some type of surgical procedure or something like that, you will wear sterile gloves. So although it's more of the physician's job to be sterile, you may also have to wear sterile gloves to assist. So be sure to watch the video under your Unit 2 skills videos about applying sterile gloves, and we will also practice this skill in class. Okay, so along with sterile gloves and sterile procedures and things, we may be tasked with sterilizing certain equipment. A lot of equipment is disposable, but some has to be sterilized because it can be used between patient to patient. So there are sterile principles and methods of sterilization. There are a set of guidelines designed to designate what items and areas are considered sterile and what actions cause contamination. So for this instance, it's talking mainly about if we're having a procedure that we're going to do. Let's use a lumbar puncture or spinal tap, as some of you may know that. We have to often set up that sterile field for the provider before they come in to actually do the procedure. So here, there's going to be a handout on eCourseWare, and it will tell you all about how to keep that sterile field sterile. For instance, anything below the waist is not considered sterile. You can never turn your back on a sterile field. So there are lots of guidelines that we have to follow when having sterile procedures and following these sterile principles. So watch that video and see the handout on eCourseWare for these principles. There probably will be a quiz question on that. So along with following those principles, after the procedure, like I said, you may have to sterilize certain equipment. So there are different ways or methods of sterilization. There's gas, dry heat, chemical, or steam. The most common that you will see in the clinic is probably steam, which is also known as autoclaving, and we use an autoclave to sterilize using steam. Another one that's fairly common is the chemical or cold sterilization, and this is when we use a chemical agent and the instrument is submerged in the chemical and is sterilized. Now, why do you think we'd use this over steam? Well, if you're thinking that some items might be too big or that they might be too sensitive to heat, then you're correct. Because if you think about different kinds of scopes that may go down into a body cavity and has like a little camera on it, that's not going to hold up very well in a steam or a gas or dry heat type sterilization equipment. So they use chemicals to clean it. It's a little bit less harsh, but it still sanitizes or sterilizes the equipment. Like I said, steam sterilization, or the autoclave, is the most commonly used method of sterilization, and it uses steam under pressure to achieve really high temperatures to sterilize. Items have to be wrapped a certain way to sterilize them. So there is a link here that I would like you guys to watch. We do not have an autoclave in our classroom, but you may have one in your clinic. So it's important to familiarize yourself with an autoclave, kind of understand how things would be wrapped, how they would be put into the autoclave, and things like that. So be sure to familiarize yourself with it. Alright, so as I mentioned, you may be helping the physician with certain types of surgical procedures. And surgeries have lots of commonalities, but they also have their own specifics. So surgical procedures, they often include different types of instruments. You may need different types of supplies or equipment. And there are different ways to prepare the patients, as well as different post-operative instructions. So different instructions to give your patients once they're going home after these procedures. So there's suggested protocols for any type of procedure you're doing, but there also may be some preferences that your provider may have, so that are unique to them. So it's important to follow those protocols, but also note that some doctors do things a little bit differently. All right. Moving along to different instruments you may see for some of these procedures. So there are different structural features for different instruments. Some of them have handles. You'll see these ring handles here. Ratchets, and ratchets are locking mechanisms that actually lock things into place. There are serrations, which are kind of like teeth within an instrument. Forceps, teeth, again, a little bit different than serrations. So these are more, the teeth may be on forceps, and they help grab tissue, a little bit sharper. The serrations aren't quite as sharp as the teeth. A box lock is a special type of hinge that's found on some instruments, and it looks like this. Here you'll see the box lock. Different prongs, hooks, or loops, so they may be different at the ends, that you may have things that have like a hook at the end or have a loop for different tasks that you need to use for those instruments. Some different categories and uses. So scissors and scalpels, what do you do with those? You cut, right? Hemostats, forceps, clamps, and needles holders, you grab. And then specula, scopes, probes, retractors, and dilators, those all help open or enlarge or explore the body orifices. All right, so more supplies and equipment. Supplies necessary for clinical surgeries are often disposable, like I said, but some are sterilized. You may have to use drapes. These are disposed of. There are different types of drapes. One is known as a fenestrated drape, and this is a specialized drape used to only expose the site for the procedure. So it has like a little circle, and then the rest of the drape goes around, and the circle exposes just the area that we actually want to do the procedure on. Sponges and wicks. The sponges are used in wound cleaning. They might prep the skin, maybe absorbable during surgery. So there are different types of sponges. And then wicks. You may never have heard of a wick, but these are often used to keep a wound open for drainage. So it's actually kind of like a packing that they put inside of a wound. It's a narrow strip of gauze, and they pack it in there, and it's usually really long, and they pack it into the wound to keep it open for drainage, and it actually helps with healing for certain wounds. There's different types of solutions, so different skin cleaners, preoperative scrubs, soaks, and antiseptics. Some examples are like betadine, Hibiclens, isopropyl alcohol, and hydrogen peroxide. There are different kinds of creams and ointments. They may be antibacterial to promote healing. There may be some creams or ointments as well. Dressings and bandages. So a dressing is the actual sterile material applied directly onto the surface, and the bandage is non-sterile, and it's what is put on top of the dressing. So can you think of something that is a dressing and bandage all in one? What about a Band-Aid? So if you think about it, on a Band-Aid, the little part in the middle is the dressing, and then the sticky part is the bandage. So it's just kind of an easy way to think of it. But that dressing is the sterile part, and the bandage is what goes around it. And then anesthetics. So these are the products that cause you to lose feeling. And sometimes they're inhaled. Sometimes they're topically applied. They can be sprayed on or even injected. So just know this is what causes the lack of feeling. So if you're going to have a wound and the physician's going to put sutures in it or stitch it up, right, you're probably going to have lidocaine injected into the site around the wound. And so that is an anesthetic, is that lidocaine to help numb the area for suture application. All right, here's some pictures of what I was talking about. Here's a fenestrated drape. Here we have a wick being put into that wound to help with healing. Lidocaine cream. We have some, what is that? I think that's some iodine sticks. This is our dressing or our bandage, right? The dressing is going to be up underneath it on the wound, and surgical sponges here. All right, the sterile field. We've talked a little bit about this already, but it may be your job as the medical assistant to set up that sterile field just before the procedure. You may set it up and move it into the surgery area, but most likely you're going to set it up where the procedure is going to take place. It's important to make sure that everyone knows it's a sterile field so no one goes in and starts contaminating it. And there's a video here that actually shows you how that setup is conducted. We also want to prepare our patients, right, before this procedure. So this may be days or even weeks beforehand. We may need to let them know that they have to adjust their diet before, or that there may be some supplies or things that they're going to have to do afterwards, right? For example, a lumbar puncture or a spinal tap. That patient's going to have to lie flat for an hour after having that procedure done to reduce the risk of complications and extreme headaches and things. So there are lots of patient preparation things that the medical assistant will be tasked in doing, so patient education. Also on the day of, you're going to be checking allergies and different sensitivities. You may be asking about the date of their last tetanus shot, which is important if they're going to have stitches and sutures. And also having a signed consent form. Now, it's not your job to explain the procedure, that's the physician's job, but it may be your job to watch for or witness the signature on the consent form and to just check that it's on the chart before the procedure is completed. All right, preparing the patient on the day of. We're going to wash our hands and greet them and ensure that they're the right person. We're going to take them back, offer any restroom facilities if we can. Make sure that they followed those procedures, like if they weren't supposed to eat starting at midnight the night before, make sure that they followed those instructions. Ask if they have any questions so that the provider can answer them if possible. Review any of the post-operative instructions. Now this is really important, especially if they're going to be going under any kind of anesthesia, or they may be getting pain medicine and they might be loopy afterwards. It's important to do that education on the front end, right? Or also educate anybody that's going to be helping take care of them after whatever the surgical procedure may be. Checking that signed consent form and any other forms that may be needed to get done. And then have them undress, get in the appropriate attire, the appropriate gown, drape them appropriately, and then also prepare their skin if that is assigned to you as your task. All right, we're going to stop here and we're going to continue on in our third lecture video, and we'll discuss sutures and removing those in our next video.